Welcome back to the Quantum Connection podcast. We are so excited that you are here today with us. We just want to let you know how much we appreciate you listening to the podcast and tuning in each week. We love sharing this information with you guys, and it's a big passion of Heather and I's. So, thank you so much for tuning in. And we would really, really appreciate it if you could write a review or maybe rate the podcast. That would be amazing. So, yeah, thankfully, you guys are doing that. So we appreciate it. So today we have a really good topic for you. We want to talk about how you know you're healing. How do you know you're getting better? How do you know you're on the right track? In homeopathy, we call this the direction of cure. How do you know you're making gains with your health condition, right? Because we know healing is not linear and it can be an up and down journey sometimes. And it's like, well, how do we even know we're doing this right or we're on the right track? So we want to have a good conversation about that today. So this should be a really fun episode. I'm so excited to chat with you about it with my co-host Heather. So yeah, let's get into
Yeah,
it.
this is so important, Vanessa, because we don't really get taught this, right? We really only get taught here's a medication or cream or whatever for your symptom. We don't get taught about the holistic approach to how the body works or holistic understanding, if you will. And I think that's a grave deficit as insofar as our own ability to trust our bodies
Mhm.
to help give us some sense of peace around what's going on. That understanding helps us to feel calmer and hopeful and to work with our bodies instead of working against our bodies by suppressing symptoms, which is how, honestly, that's how a lot of these illnesses start to begin with, either suppressing symptoms or the body isn't getting what it needs. So when I learned this with you in our class in homeopathy, it was like that moment when you have that little emoji that the mind is blown. Wow, it's so it's so fascinating, but it makes so much sense
Yeah.
that the body has its own wisdom and it has its own way of handling these insults. And when it can't complete a healing process, because, like I said, you're either suppressing it with, things like jabs or medications or whatever, or you're also being bombarded with unhealthy things like non-native EMFs and so forth, the
Mhm.
body gets kind of bogged down. So there's going to be layers of illness. And then, of course, that makes it logical that you're going to have layers of healing.
Oh yeah. Yeah, it's like the onion. We got to peel back each layer at a time, right? And once we heal one thing, the next thing is going to come to the surface, right? Something hopefully that we've suppressed in the back, of time, somewhere in the past will come back and then we'll be able to heal that because that's actually a really great sign and one of the directions of cure we're going to talk about today. But I think it provides a lot of level of safety in your body if you understand this because then you feel like, oh, okay, this is a good sign of my healing and it makes you feel more secure in what you're doing is actually supportive to your health and to your body, right? So a lot of homeopaths have discovered this. A lot of homeopaths have studied this through their own clinical practice, right? So they've watched their patients go through the process of healing and they've recorded their notes and they've learned that there are several what we call directions of cure. You might hear the word law of cure, but it's just that all that means is how you know you're healing. And actually, it's really interesting is one of the main homeopaths who wrote this down, Heather, you're going to like this story. His name was Dr. Constantine Herring. He was actually an allopathic doctor who initially thought homeopathy was complete BS and nonsense, and he wanted nothing to do with it. And he actually his mission was to set out and prove that homeopathy didn't work. He was studying it to prove that it was BS, basically. But he was actually totally unable to do that at all. He couldn't find anybody who wasn't making progress and gains in their healing. And he kept seeing that it was working. And then he himself came down with gangrene and he tried allopathic medicine and it was unable to help him. So he's like, I'll give homeopathy a try. Why not? And guess what? That quickly cured him. And then he actually studied homeopathy and decided to become a homeopath and actually is one of the greatest homeopaths of our time. So it's a very interesting story, right? So anyway, he was, very convinced with the healing power of homeopathy. and he continued to do homeopathy on all his patients from then on. And, he was the one who actually came up with this law of cure. So I thought you would enjoy that story, and so would our listeners, because it's just like,
Absolutely.
yeah, because it's like, sometimes,
What a great testimony to
yeah,
the curative impact of homeopathy, just how the depth of healing and how quickly it can restore that functioning to the body, right?
yeah,
Because it works at that deep energetic level of helping your immune system to become more fortified so that the body can begin to push out whatever the toxin is in or the bacteria, malaria or gangrene, right? So the
yeah,
bacteria, right? Yeah.
yeah.
Cool.
It is really cool. Yeah, because it's just homeopathy. I always like to say it's that catalyst, it's that nudge, it's like that stimulus that just gives the body that reminder of what to do. And then really the magic is in you. The really your body is the one who
Yes.
does the work,
Yeah.
right? So I think that's like an important take home. It's not a medicine, yes, it does some work and it helps remind, but you do the heavy lifting. That's why it's like taking your immune system to the gym. That's why your body gets a workout in a great way, like because it gives that little bit of, I don't want to call it a toxicity because it's not, because it's just an energetic of that, but it's almost like it's giving your body like that little toxicity and nudge to be like, this is what you need to do. This is what you need to go after. And then the body does its job and self heals. So it's pretty cool.
Well, it's
So
kind of like an energetic, like your body recognizes it as something that it needs to react to
yes,
defend against, but it's not, there's no toxin because the homeopathic remedy has literally no original substance left to it, but your body doesn't know that. Right. So it's still responding as if it is that actual substance because of the energetic resonance. And that's why it's a quantum medicine that's really hard for people to understand. Like there's not an actual substance like aspirin or, whatever,
right.
that kind of
Yeah.
thing. But it's not just unique to homeopathy. So we're talking about the body's design and the body's, how the body works. But other practitioners have seen it like insofar as circadian or quantum biology and other ways of healing. So it's not unique to homeopathy. It's just that in the world of homeopathy, it's been very closely studied and
Mhm.
documented.
Yeah, other great homeopaths like Kent has also, and George Vatsoukas has actually written about this in his book and his Science of Homeopathy and Levels of Health, and also other books by Kent. This one, I think, Lectures on Homeopathic Materia Medica, and the one I have upstairs also documents it quite aggressively as well. So it's just they're, these, science, homeopathy is very scientific, actually. People don't think that at all, but it's extremely scientific. And they wrote down all of what they noted and saw. And then they took all this and they, found these directions of cure, or that ways that they knew that their patients, they were signs that were continuous, that they said, oh, this happened, I know my patient's on the right track. And then again, like it helps us now in our time, know that when we have clients, if we see these signs, we're like, yes, we know that the patient or the client is on the right track to healing. So it's just super cool. And yeah, I love it. So it's good to talk about for sure.
This might be really new for a lot of our listeners and viewers. So, what is the first place you might describe? Like, what is direction of cure? What is how the body begins to push out the illness, so to speak? There's a beautiful order to it. Yes. And that
Yeah.
order is the body is always trying to preserve the most essential organs and functions first. So tell us about how that is, Vanessa.
Yeah, that's one of the directions of cure. Well, I don't have, that's the third one I have, but it's okay. We can talk about that one
Sorry,
first.
we're out
It's
of order here.
okay. It's all right. It's all right. It's all right. I have to remind myself of where I am on my notes. So, that one is the healing curves from within to out. So the most important to the least important organ. So example is the brain and the heart are our most vital organs, and the skin is our least vital. So that's the last to heal. So for example, the mental emotional should clear first, or of vital organs, if that's affected, should be addressed first. Like those are the things that should happen first. So on the mental emotional, or in the brain, you're talking anxiety, depression, panic attacks, suicide, neurological disorders, all of those kinds of things would be the thing that we expect to heal first. We want to heal the anything that's going on in the mental emotional the brain
That may
area.
be kind of confusing because how does that relate to what we think of only as physical illness? Well, the way that it relates is when the physical illness becomes so suppressed or
Yes.
pushed down in the body, because of the medications you're taking and whatnot, or the trauma that hasn't been processed through, the body is at such a state of being compromised, it will result in a mental emotional condition.
Yes.
So
Yeah.
that's why that reverses first, if you will,
Hmm.
right? Because that is a little bit more serious, so to speak.
Oh yeah. Anything on the mental emotional is more serious. So anxiety, depression, apathy, all of that. So like if you come to, on your healing path, come to a homeopath, come to whoever, and you have anxiety and you also have bloody noses, it will be great if the anxiety healed first and then the bloody nose is healed,
Which
right?
is
Because
hard for people to make sense of, though, because it seems like the
yes.
bloody nose is so much more severe and serious, right? Oh my God, blood coming out of your nose.
Yeah. But anxiety, yes, that's the most important organ is your brain, right?
Yeah.
Same thing like if it was heart disease, right? And you also have joint pain. Well, we want the heart to clear and then the joint pain to clear, right? So same thing. Or like you have insomnia, but you also have eczema, right? You want the insomnia to heal and then the eczema to go. Same kind of things. Like another one is like depression. You have depression and runny nose. Well, the depression will heal and then the runny nose. It's not as important. In fact, the runny nose would probably get worse and then in that process. And the same thing with the bloody noses that could really tick up a little bit too, as well, because that's a way that the body is letting it out. If you have panic attacks and skin disorder, okay, let's get the panic attacks. The body's going to hopefully heal. That's how we know the body's healing. The panic attacks are starting to lessen, and the skin stuff actually probably will uptick a little bit, and then that would over time the skin is the last thing. I know nobody wants to hear this, but the skin is the very last thing to heal,
I
honestly,
know.
because it's our least vital organ. Even though it's a big super organ that we do a lot of detoxification through, it is the least vital. So it's the least important that we have to heal. So the body's got to do what's more important first, and healing brain or heart or any kind of internal organs, that's really more important. So yeah.
Mhm. Well,
Yeah.
and then you talk about how does this happen, though? And it's literally reversing in the order in which you had experienced initially some kind of symptom. So acne or whatever, and then you took, or eczema, and then you took some kind of steroid cream, and then that will then lead to, what does that usually lead to?
Usually that's asthma. The
Asthma. See, there's these relationships that happen.
mhm. Yeah. Acne can also, you said acne?
Mhm.
Acne also leads to gut issues, suppressing of that,
So there's a
usually.
correlation there, and then the eczema suppress that. You're saying that leads to asthma.
Hmm.
Yeah,
Yeah. Sorry, my
so
brain was
fascinating.
thinking that one.
No, yeah, yeah. No, you're
Yeah.
good. It's all good. So lots of stuff to remember. But it's
Yeah.
like there's these particular orders, or how should we call it? Is it an order or timetables, if you will? This happened, and then we suppress that, and then this happened.
Yeah. Joint pain typically to heart disease also.
Yeah.
That's a very common one. UTIs lead to depression. Suppression of UTIs leads to depression is a common one. So yeah, it's just it's unfortunate when we suppress symptoms, especially on the skin too. They can really lead to deeper things. And yeah, even like a suppressed ear infection can lead to strep or then pneumonia, or my chronic migraines, like all of these things. So we got to go back the other way,
Yes.
which is the other direction of cure when symptoms appear in reverse order or you have return of old symptoms. So your new symptoms heal before, and the old symptoms will come back. Like we've healed the upper layer and now a new, like an old layer that you've suppressed in the past comes back. So example, you heal the asthma, your eczema comes back, right? Because you've suppressed that, which caused the asthma, and now this is back to the surface to heal again. So yeah, that's very, very common and actually, honestly, one of the best signs of healing.
We have to
Like,
really emphasize that, Vanessa, because I think it really doesn't make sense to people, and they're going to think that they're getting worse, especially because skin
yes,
is so hard on us socially, and it's
yes,
just awkward for us. But it's actually a really, really good sign, because now that means that whatever the body has been able to dislodge and start to push outward is going to manifest in skin. And also that's what had happened before. It all ties together. It all works together, right? It all makes sense.
Yeah, yeah, 100%. Like, for example, if you had acne, like you said before, and I said it was very related to gut. So, okay, you have acne and you have diarrhea. Well, the diarrhea heals and then your acne returns, right? This is another good sign. And again, your body, it's moving, same thing. It's also moving from the inner organs to the outer organs again, also. You heal chronic headaches and then an ear infection returns. This is actually a really great sign. Hormones heal, skin issues return, anxiety heals, diarrhea returns. These are all kind of the same thing. And they let you know, like, if you are working with a homeopath or working on some sort of healing journey and you're like, I had this thing that, I thought I dealt with and it was gone and I haven't had it come up in a long time, but now all of a sudden it's reoccurring. It actually means that you're probably on the right path. So, and like you said, I know that could be scary. I fear that my alopecia areata could come back, let's be honest, because I don't really want that to come back. But honestly, it was suppressed. And I know in my healing journey, it might have to come back.
So you took some medication for that.
Oh, yeah, I put steroid cortisone in my head
You didn't
every.
know. So let's just humanize this. Could
I
we
know. I did not
uh,
know. Every 3 weeks too, Heather.
alopecia hair loss?
Yeah, big giant, like I had like almost like quarter size. Yeah.
Pretty significant. So of course you're going to treat it because you were probably freaking out. This is normal.
Yeah.
Because in those days you didn't know any of this. You didn't know about homeopathy and that
No.
was your body reacting or trying to, heal something or whatever. A symptom isn't random. There's a reason for it, and it's the body's way of showing you that it's working on something. So it can't maintain all of its functioning when there's that much distress or dysfunction going on. So the hair kind of was like, oh, we can't hang on to this hair right now.
It's least important.
The least important, right? It's just for, it's just the thing that happens on your head, but
Yeah.
it isn't necessary to survive to have a full head of hair. So
No.
you did what most people do. So that's pretty typical. You're like, oh my God, my hair's falling out. Let's fix it. You put the steroid cream
Mm-hmm.
and
Oh no,
so,
those were injections into my
oh,
brain. Goodness
injection.
gracious. Yep.
So I know this is hard to talk about, but people
Mm.
need to hear that, because nobody talks about the reality and the
Yeah.
truth of what happens to us. We want to oh, here's the quick fix. That's not how it works, people, right? It's hard and there's stuff that happens and we don't like it. And we're going to try to figure that shit out, right? And fix it.
Yeah,
But
well, we want the
at
quick because we don't want to have bald spots in our head, but we don't realize
exactly
that that's actually going to have a consequence on our health later on in life.
right. So you now know that that wasn't a helpful thing to do. So you're saying, uh-oh, now that, because you're so much better now than at those days, right? You've
Yeah.
healed. I know I'm not where I want to be. You're not where you want to be. We're always going to be healing, right? Till we die. But you're saying, oh, does that mean that the alopecia is going to come back? It may or may not. We don't know.
Yeah, it may or may not, but like I can even use myself as another example. I had pretty severe depression, almost to this point of suicidal depression. And well, it was. And it had come back a couple times with some remedies in a low degree, but that's scary, like when that comes back. But I knew that was a sign of healing. And also, of course, my depression is gone. I don't have suicide. I don't have any depression anymore. That's all healed. But then a bladder infection comes back. You know what I mean? So these are also like that's something I've suppressed. So that's really good, actually. So I know it's like
I have some of
challenging.
that too. Like
Yeah.
something that never had happened before with these little like cold sores coming on. I'm like, what? Because I didn't
Mhm.
do anything that normally when I get really stressed or if I eat too many carbs, boop, I got the things coming out. Because I used to get those a lot. But then when I took this last remedy, I started noticing these coming out. And of course, I'm like, I don't like this.
That's actually a really good sign, though, Heather.
Let's just not and skip over this part. And I am though Vanessa, I try to remind myself, and they're just like one little dot, and that's it. So it's not like this horrible thing. I should be grateful, but it's still weird. It's like, why am I getting this thing when I'm fine?
It's the healing,
I
though.
know,
It's
I know.
healing. Healing is messy. I think people don't realize that too. It's
Hmm.
messy. It's not like this linear straight line of just,
Every day I feel better and better.
yeah, it's a little bit up and down and messy. Like, let's be honest. Like, if you want the reality, that's the truth of it. So, yeah.
Guys, we're not sugarcoating this for you.
No, no, we can't sugarcoat it because this is the truth, right? I mean, that's. And not everybody's going to be thrilled to see, eczema return or things like that.
Acne.
I'm happy about it. Like I've had a little bit of acne. That's great.
You're excited.
Actually, like I'm like, oh my God, because actually that means that instead of my liver being burdened with shit, it's coming out in my skin. And
Right.
actually weight gain was something that I noticed too with homeopathy. Weight's always been an issue for me my whole life. I have to work really hard to like maintain it. All the quantum biologies and meal timing and all of that has been really, really extremely supportive. And actually, though that's a layer that is definitely in me. I have a very strong carb layer that's going to eventually have to come to the surface, and weight gain is part of that picture. So, I mean, not that you're going to have to gain 50 pounds and know that you need that remedy. That's not my point. That's what I'm saying. But like, it's a small little pieces of it might come back, and you're like, oh, okay, this means that this is the layer that needs to be healed next. You know what I mean? So it's part of the journey. It's that
Trusting
old
your body.
yes, and you really have to trust your body, which is hard for people because every time they have a symptom, they want to, get rid of it immediately. And, that's
Panic.
not really supportive to healing,
And instead of thinking, oh my God, what's wrong with me? We should think, oh my gosh, this is a symptom. My body's working on something. How can I support it?
Yes, yes,
Right.
yes, yes, yes,
And
yes.
help it work to its own benefit versus taking away that or interfering with that process, right? That's what
Mhm.
we do by suppressing. So what's the other direction of cure? There's another one that's harder, a little superior, distal, da da da.
Yeah, yeah, superior to distal. That's like it's either top down, they call it, either from top to bottom, or like it's also kind of like the inner to the outer, superior to distal. So it's like if you have eczema, say you're on the skin and it's on the torso, and it moves to your extremities, moves
Mm,
to your feet, it moves your
that's a
hands,
good thing.
right? That's a really good sign, right? So the symptoms leave from the top to the bottom or from the inner to the outer. It also could be like if you have joint pain on the shoulder and it moves to the fingers,
Uh,
same kind of thing. That's,
it's almost like it's exiting the body that way, right?
right. It's a sign of exiting the body. Or if you have organ pain and it moves to the joints, right?
Wow.
So that's also the right direction, right? Or hives or any kind of rash on the chest, it moves to the legs. Like these are all really good signs and directions that, the body's pushing it outwards, Your extremities are also way less important than, if everything's by your organs, you know what I mean? Like can live without a finger, but you can't live without a lot of organs, right? So it's like it's all really the same kind of thing in my mind. Like it's all really like the inner to the outer, the most important to the least important kind of things in your body. That's how I view it. Those are really good signs. And returning of the old symptoms is really, really important because when you get the return of old symptoms, I want to go back to that. What that actually means for you guys listeners is that the homeopathic remedy or whatever modality you're deciding to use is actually removing a layer of suppression, right? So I just want to clarify that it actually means you removed a layer, right? And now you can get to a deeper layer in the onion. And that's really what we want to do because
Right,
we
because
all have
somebody's
a lot of
body was trying to rally, the immune system was doing its job, which means there's going to be inflammation. Inflammation is part of the healing process, right? Then
right.
we come in and interrupt that, boom, with chemicals and which are really like toxins, like medication. The body gets stuck right there, and then what it was trying to do to heal that, whatever that illness is halted, and then the illness stays in it. That's a layer, is what you're calling a layer, right?
Yeah, yeah, 100%.
And it
Because
stays there until you help the body resume the healing process.
yeah, your body's like stuck at that one layer, until you can start to try to get rid of that suppression somehow. It's like it's like a brick, it's like stuck there in that one spot and it can't get over the hump, and it doesn't know how. So yeah, that's exactly
Well,
what it
it's
is.
been energetically compromised.
Yeah, yeah, because we've suppressed it. That's part of the problem.
Mhm.
So
Mhm.
yeah.
What
So
else? Did we miss one? Is there another one?
no, just those three. So those are the three that are the main important ones. So reverse order, return of old symptoms, right? So you're healing in the reverse order, return of old symptoms that you had in the past, especially from when you were younger, because we also have to realize that the medications that we've taken even our whole lives, you know, when we were younger, they have an impact on us. So it could be something that you've taken or had way back when, you know, actually that's great. That comes back. That's something that you had when you were younger.
Oh no, you saying I'm gonna get the croup? Colic?
Might.
Perhaps, I know,
Would be
right?
great. I'm waiting for my son to get Coxsackie back. Oh, that was
What's
fun.
that?
Oh, hand, foot, and mouth.
Oh,
Yeah,
oh.
and they also had
Huh,
oh man, what was it? I mean, they I'm waiting for their skin stuff to come back. Not yet, but hopefully it again, this stuff takes time for
yeah,
your body to do this work.
yeah.
It is not like, oh, I'm gonna take a remedy or I'm gonna do this protocol, whatever you decide to do, whatever. It's not like that's gonna all of a sudden, like a month later, you're gonna have your childhood illness come back. Probably not. It's gonna take
No.
it
Well, it
takes
depends on a
time.
lot of things, your genetic predispositions, the health at which
Oh
you
yeah.
enter the world in, so your overall level of health, the amount of suppressive drugs you've had, the amount of trauma and shock you've had, all of those things
Hmm.
going to impact your body's ability to heal itself. So that's why homeopathy, I mean, there's so many things to love about it, let's be honest, but gentle, non-toxic, right? It helps your body to heal itself. It's giving it reminders, you can do this, but
Hmm.
also it's a gentle sort of, I don't want to say slow, but it works with your own body's own pace. Like it's not about the medicine, it's about your body's ability to heal. So if your body took 20 years to get sick, you're not going to maybe heal in 2 weeks. Like maybe if it's a miracle, there's things that happen, spontaneous remission, whatever. But more likely, it's going to be a journey that you got to be able to be patient and give yourself some break, give your body a break. It's doing the best it can. That's where the trust comes in.
Hmm.
That's where, having a really good homeopath is important, who can help you stay the course and remind you that this is normal, this is what's supposed to happen, right, Vanessa?
Yeah, and it's really important to check in with them too, I would say, because a lot of times I'll meet with clients and like, I'm not really sure if anything's getting better. I'm like, well, what's happening? Tell me. And they're like, oh yeah, this and better. And like, as you start asking them questions about the symptoms that they had. How's this symptom? How's that symptom? Da, da, da. And they're like, oh yeah, that's better. How much better? Oh, like 50% better. It's happening less frequently, like okay, that's good. Like sometimes we don't see it in ourselves, and I do it too. Like I, don't see it in myself sometimes too. So it's really, really important to have somebody to coach you through that and be like, oh, this is actually improving. It's
Mhm,
definitely helpful. So yeah.
mhm,
Yeah, really, really important. So this is what you want to look for. Like symptoms appear in reverse order, return of old symptoms, you know, oh, I'm looking at the wrong part of my screen. We're looking for mental, emotional to clear first. That's really, really important, right? So that's the
mhm,
takeaway. We want to make sure that the mental, emotional is first to clear. Energy should improve and sleep should improve. I think those are really other good takeaways to know if you're on a good healing journey, that your energy is good, your sleep is better, the brain and the heart are the most vital. And if you have any issues there, we want them to be cleared first. And that, again, the skin is the last organ to heal. So if you have something on the skin, that's actually not a bad sign. And, it actually means things are more on the surface, right? So that's actually really good for your body. And it's going to take some time to get that going. And also, return of old symptoms that were suppressed is an awesome sign. And then I really want to talk about this one because we didn't mention this one yet. This is really a good part, is getting an acute or a fever
oh
is
yeah.
really an awesome sign of your immune system strengthening. So a lot of people don't realize that getting an acute, like an acute means an ear infection, a strep throat infection, a UTI,
High fever over 102, right?
yeah, 101.3 or higher.
101.3 or higher.
Yeah. So if you got to get a fever though with those acutes, this is the best sign actually
Yes.
of your immune system healing,
Yes.
because a lot of people who are chronically ill, myself included,
Me too.
don't get fevers anymore. And the body's way of burning up pathology and healing is to create a fever, which actually creates your own infrared and makes your own easy water actually produce more easy water and makes your body, heal from that quantum aspect also. So getting the fever is a huge sign of your immune system coming back online and that you're healing and strengthening, because your body is now able and strong enough to mount that fever
Mhm.
to uproot the things that it needs to uproot. So that is the other amazing sign that I wanted to bring in. And I want to say, getting a fever on your own is not the same thing as jumping in your sauna. Those
No,
are
that's
two different
artificially
things.
induced. That will not achieve the same results, not the
But
same
people
thing.
say that. People tout that.
Mm-mm. Mm-mm.
And I haven't even have a post about this on Instagram because I think it's really, really important
Yeah.
because actually it was one of the great healers. Was it Hippocrates that said, you have the body produce a fever, give me a medicine that will produce fever and I can cure any disease. That actually has been shown true. Like people who are really severely mentally ill, they get a fever and they're actually kind of
Oh,
normal.
right. Their
They're
psychosis
normal
will
for,
go
yeah,
away.
they're completely normal for a while, right?
Powerful. Yeah.
So, and then, they give them a medicine and then it's back to the same ball game. But
Right.
if that was a really great sign for them. But my point is that a sauna is just going to artificially induce that heat in your body. It does help you make easy water. It helps you make some infrared. It's going to support the body, but it's not the same as your immune system, your body creating this fever response that your immune system did that. Your body did that, not coming from, like you said, an artificially source.
Well,
So,
some might even argue that saunas could be harmful if you have a pretty low level of health, because if you don't have good
oh
detox
yeah.
pathways and drainage and you're trying to heat yourself up, there's nowhere for that stuff to go. And if you're not sweating well, that's not good. So,
Yeah, I agree. You need to be able to sweat.
hmm
Use a dry brush, to help get the lymphatic system moving. And also you have to make sure you're drinking enough minerals and
right.
consuming enough minerals in your body, a diet as well. Because I actually, when I have a nice sunlight and sauna, but when I first use it, I might be the kind of person who overdoes things sometimes, right? I
You
just
and
might
everyone
be,
else.
right? So,
More is
um,
better, Vanessa. No, I'm kidding.
yeah, more is always better, right? Same thing with the cold plunge when I started doing that. Yeah, just go every day. No. Anyway, though, I used to use my sauna like very frequently when I first got it, and I felt very depleted after a little bit of time doing that
Yeah.
because it's just too much on the body. And I honestly think it's just depleting to us. So
That's
you're
why
better
we need
off.
the body to do it itself. So helping the body restore its capacity to rally and create its own defense of a fever, right? And people freak out about fevers. So unless
Mhm.
it's like over 104, I would say let it be. That's not medical advice. This is just from our own experience. I'm not telling
Or
you.
you meet with your homeopath and they can help support the
Schedule
fever.
a session with us. Yeah.
Yeah, schedule an acute session. And this is really important. I want to say this for my homeopathic clients. Um, if you are under homeopathic care and you are, for a chronic condition, right? And you develop an acute, let us know. Let it book in with us. That's really, really important because if you suppress that
Mm.
with medication or a drug, you're kind of going backwards. So
Undoing everything that was good, happening that was good.
because this was really a good sign and then we've undone it. So we need to, and then we have to wait a little bit of time too. You can't, like, if you've taken that medication, we have to wait a couple weeks to see what comes up as well. Because other symptoms may present because of the interference of the medication. So if you're under, care of a homeopath, whether it's us or one other one, if you have an acute, you let them know, and then they can treat it with homeopathy instead, which will just support the body in healing again instead of suppressing the body's symptoms. Um, and of course, people get scared about high fevers. I get it. I'm a parent, but my kids have dealt with some fevers. Actually, that was a great sign, right? My oldest got quite a few fevers this last 2 years.
We were probably so happy.
I was so excited. Yeah, yeah, I really was. I was like, yeah, you have a fever. And he got one of them was over 101.3. So that was really great. So I know his body burnt out some shit that doesn't belong, right? Got rid of in his God, he got stronger. And
Yeah.
he hadn't had fevers for years. It's a great example. I
Mm.
mean, he hadn't had a fever probably in at least 3, 4, 5 years. I can't remember. So this was huge. Like this is a great sign of healing. I can't wait for it to get a fever. I had a small one, but I'm not really sure it counts because it was from apparently I had, that virus that's going around. So if that was even what it was. So it was only like
Sort of
one.
toxicity, perhaps. Mhm.
It was probably just EMFs, I'm thinking, because I was in Florida at the time. And
Oh,
yeah, I was in Florida and I was in Disney. This was not this year, but the year before. And I think it was just from being in with the EMFs, because come on, you're sitting in one of those like arenas for like a show, and there's like 3,000 people with everybody with their
Oh,
phone.
no. It's a
You know how
chemical
that
or
is.
frequent, it's like
Right.
it's just a bath of toxic or
It's the
harmful
microwave.
electromagnetic frequency. Yeah, it's a microwave. Yeah, perfect microwave.
So I was just like, I think that's what it was. So I had a low grade fever with that, but I'm still waiting. It's going to happen eventually. I know it.
I honestly don't know the last time I had a high fever. I really don't know. So you'll be the first to know as soon as I get one. Okay.
I'll be so excited for you.
We'll
But it's
celebrate.
a time for that to happen.
Yeah,
Yeah, celebrate the shit out of that. Mine, the
I'll
last
get
one,
there.
my real last real good one was in 2019. We
Mm.
were on a cruise and we had a they said it was a neurovirus or whatever it is. So I don't know. Some sort of virus there. We don't know if that's really true or not, or what it was, but we were all really sick. So that was really fun. They put you in cruise jail for that. So,
Oh, it sounds awful.
it was
Trapped,
awful.
Hmm.
Literally everybody's throwing up and having diarrhea, and we have to stay in that small cabin and we're not allowed to leave. Yeah, that was fun. And Matthew, my youngest, was a baby. So
Oh.
yeah, we just threw his clothes out, you know. So that was fun. It's good times. So yeah, fever is a really, really great sign though that your body is putting up a really good fight and you're strong enough to get rid of the things that don't belong.
Mhm.
So yeah, really a
This
good
has
one.
been a powerful episode to help to address the myth. Well, even just starting out at what is healing, right? And
Yeah.
what does healing look like in your body? Your body will go through a certain series of processes and it will show you a series of symptoms in a particular way and in a particular order in particular directions. So that was the whole point of today, so that we can help educate people, Vanessa, about like being able to understand what the heck their body's doing. And
Yes.
it's just a symptom. That means your body's actually healing itself. A symptom is not a bad thing. It's inconvenient, yes. It can be painful, yes. Whatever, it could be unattractive, but it's really about your body doing what it needs to do. So trusting your body, understanding why it's doing it, consulting with your provider, whether it's a homeopath or whomever you choose, hopefully an alternative holistic healer, right?
Mhm.
Because, let's be honest, mainstream allopathic doctors are going to laugh at you if you talk to them about any of this stuff. So unfortunately, that's the world we live in. I actually did go see an MD homeopath years ago. I don't know
Hmm.
if I told you that. I'll tell you about it when we're done. But that was a very interesting experience. Yeah, he was a super nice guy. I didn't really know that much about it at the time. And I was like, this is taking an hour and a half is kind of a long time. But he was super thorough, which was amazing. But I didn't realize what I had was my insurance was paying for it.
That's
Yeah.
awesome.
Wish I would have kept that going, but I didn't know. I didn't know how
Yeah.
amazing. I didn't realize what gold I had. So now we know, and that's why we're doing this podcast, is to educate all of you in finding ways to support yourself. And don't forget that the mental emotional are a huge piece of this. And that is what we want to see shift first. And, the mental health world, homeopathy isn't even a thing, right? So one of my missions is to bring that to the forefront and help people
Mhm.
see how homeopathy really is very powerful at helping to address any mental or emotional problems. So,
Yeah, it really is. It really is. It's so powerful. I saw that in myself. I've seen it in my children. I've seen it in clients. It's really great at that. It's also great at acutes also. When
yep.
you have an I can't believe some of the things that I've cured with acutes. Like one's been had pneumonia. I'm like, all right, let's give her a remedy. And it works. And it's like amazing.
Nice.
Person was gonna go to the hospital. Like, I mean, it's amazing. So
What did you give her?
it was what remedy?
Hmm.
It was calcarb.
Yeah. But these remedies aren't like, that's not the remedy for X situation. You have to have a
Right.
session so we can look at the totality of your symptoms, because each person's going to present differently. And we have to tailor the remedy to your situation. So we don't want to give you the impression that, oh, if you have this, it's always this remedy. That's not how it works. So,
That is such a really important topic to talk about, and we'll just take a minute to say that. Like, you cannot just be like, go Google search what homeopathic remedy should I take for ear infection, or what homeopathic remedy should I take for the flu or pneumonia or UTI. You have to understand the person's symptoms. That is how you get the correct remedy. The homeopathy treats you, not the disease. So there is not a remedy for UTI. There's not a remedy for ear infections. There's not a remedy for hepatitis or pneumonia. We treat the symptoms of that person, and everybody experiences those illnesses in a very different way. mean, some things may be similar, but it's going to have its own unique vibe to it. You know, I knew it was calcar because the person had really cold feet. Like there were things that like helped you help us out, how we know what the right remedy is.
Mhm. Love
Yeah.
it.
And I also wanted to remind you that the symptoms are the healing, like Heather said before. The symptoms are the healing. And that was really helpful for me on my own health journey to understand this is what my body needs to do to heal, right? That's part of the healing process. So again, takeaways, like Heather said, look for the mental emotional to clear, energy, sleep improve, heart, brain, improve or heal first, and return of old symptoms, acutes and fevers, and reach out to us. Now, of course, I'm taking new homeopathic clients, on right now. I don't have a lot of room for new full sessions, but they're there here and there. So go ahead and check that out if you want to. But yeah, homeopathy consults, you have to book an initial session. I just want to remind people because I had somebody make that error on my website recently, and that's okay. It happens. They booked an acute for a chronic thing. So
Oh,
if you're having anything, yeah, if you're having anything chronic, meaning that you get it monthly or you deal with it on an everyday basis, or you get it even a few times a year, this is really a chronic situation. So book in, please, for a chronic consultation, or actually on my website, it says initial. That's the first time you're meeting with me. That's the one. Now, if you get an acute, of course, that can help too, and Heather can help as well, whether it's, like I said, pneumonia or, bronchitis or ear infection or strep throat or UTI, whatever. We can also treat those things as well. But I don't know, Heather, if any other modality that I know of actually helps strengthen the immune system so much that it brings back fever besides homeopathy that I've seen.
not that I'm
Uh,
aware of. I don't know. Mm-mm.
yeah, I don't know of any other modality that can help bring back fever. So that is one way to get to know if your level of health is low, is if you haven't had a fever in a while, and this is a way to help bring that back for you.
Mhm.
So book
Want
in
to
with
get
Heather or
started.
I
Yeah.
for homeopathy consults. It's a really great way to really up level your health. And of course, all the circadian biology stuff we also teach is super, super foundational just to
Hmm.
support your body on healing. So I know Heather and I both have offerings for those. So check those out because
Right.
yeah,
Homeopathy compared with circadian biology and quantum, that those kinds of quantum approaches is really, that's a magical combination, right?
yeah, so
It's do so
synergistic.
much for your body. You
Yeah.
can look on on the show notes, you'll see our links to our websites on how to book a session with either of us
Yeah.
and start. You got to just start somewhere, start to implement these practices. Really, you're supporting what your body already knows how to do. You're giving your body what it needs from its environment. This is really a really the way to go, as far as, obviously we're biased, but we have experienced, each of us, the most amazing healing from the combination of homeopathy and circadian biology. So that's why we're bringing this to you today. So
And we've tried everything else under the sun before that. So we have experienced
exactly.
all the things. So
Oh,
yeah. Yeah.
everything, the
Yeah.
diet and the functional, blah, blah, blah. So
Yes.
thanks so much for tuning in today, everyone. This has been a really fun episode to talk about something you're probably not going to hear on a lot of different podcasts. So we appreciate you tuning in and bringing the message of the power of healing of homeopathy to the world.
Yeah. Share it with others, please.
Yeah.
Good day.
All right. See you next week.
Bye.